Doctor, you're welcome. Brother Cosmos, it's a long time. Good to see you. I think maybe let me bring Doctor. I don't know. Doctor, will you like to join me online? Doctor, can you hear me? Please, I need you to tell me if you can hear me. Hello? Hello, can you hear me? I don't know if you can hear me. Please, I need you to indicate if you can hear me. I need you to indicate if you can hear me, please. Okay, I'll just wait for like 3 more minutes because it's actually late here already. 3 more minutes and I'll start. I'm just waiting a bit for others to join because it's very important for us to know what causes autism in children and ways we can manage autistic children. So if you are online, please join. Let's start. Once it's 5 minutes past 4, I will start. So let me just give a brief introduction of what I'm doing here today. Today I'm going to talk about autism. Autism is a behavioral disorder, and normally you notice it in children. That's what you notice, and it doesn't have any cure. The person has to grow with it and it has to be managed. We are going to look at the symptoms. We will look at the causes. It's very important for us to look at the causes because there are ways at which we can even prevent us having children with autism. That is, if you don't have it, if it's not in your gene, because autism can be transferred to the children via gene by saying it can be hereditary. It can be inherited from the parents. We will look at the causes. We will look at the different types of autism. There are different types of autism, so we are going to look at the various types of autism. There are some autistic children that can still go to school, attend classes, and most of them are very, very intelligent. I'm just giving you a brief of what we are going to discuss today. If we cannot finish today, we can continue next week Sunday. I will try and come up on Sunday also. Then we'll look at the symptoms to look out in your children. The symptoms most times comes, you notice it when the child is around around 1 to 2 years old. That is when you start noticing these symptoms in them. So we'll discuss the different symptoms that you can find in an autistic child, and we are going to discuss. We'll talk about how can it be managed. Like I said, autism cannot be treated, cannot be cured, but it can be managed. You know, you can help the child improve. So I think it's time. So let's start. So what is even autism? I know some of you might not be familiar with this word. Some might be, those in education field, especially those in special needs field. And in fact, I just dropped a call with a friend now. He was just telling me that a family has an autistic child as their first child, and in fact, because of the child's problem, it has really caused problem in their family. In fact, he said that it's so bad that the mother took in again, and instead of her to, she just went to abort the child. So dealing with an autistic child can be very, very traumatic. It can be very, very, very traumatic. So what is autism? First of all, autism spectrum disorder, also known as ASD. It is a broad term used to describe a group of neurodevelopmental condition. When you hear the word neurodevelopmental, we are talking about the brain. There is a condition that has to do with development and everything. It's a disorder, you know. And the basic symptoms, the major symptoms you notice in an autistic child is that they find it very difficult to communicate. It is very difficult to communicate. They cannot talk. They cannot even pronounce some words. They will just be blabbing or like singing sound, like, you know. And they have poor social interaction. Yes, and they have this behavior of repeating something. For example, the child can just be repeating, let me go, let me go, let me go. Repeating, or will be repeating a particular behavior, you know, quickly. He might just be doing, just repeating and repeating and repeating and repeating. They have that in them. I'm going to talk about, define some terms here, so don't worry, I'll break it down. According to Center of Disease Control and Prevention, ADS, which is autism, is diagnosed more in boys than girls. A boy child has high tendency to have autism than a girl child. The ratio is 4.3 to 1, meaning boys have higher chance to be autistic. If you have 5 boys out of how many children? 5 boys, like out of 100, the ratio can be 5:1. 5 boys can have autism, and while before you finish counting 5, you only see only 1 girl with autistic disorder. Let's look at the causes, because I don't want to take our time. I just want to give you people the basics. Number 1, it is hereditary. Autistic disorder can be inherited from the parents. Might not be directly the immediate parent, maybe for great-grandparents. Through gene, it is hereditary. That's number 1. Number 2, environmental factors also contribute to autistic disorder. Such environmental factors are smoking, tobacco. You know, the woman, maybe when she was pregnant, she smokes, drinks, you know. Also pollutants, exposure to pollutants, environmental pollution, metal, and so on and so forth. I'm still going to talk about more things that can cause it. I'm just giving you the brief. Now, what types of, we have different categories, subtypes of autism. According to the Diagnostic and Statistic Manual of Mental Disorder, 5th edition, they have discovered 5 subtypes of ASD. That's autism. That's yes. Number 1 is with or without accompanying intellectual impairment. That's number 1, the first subtype of autism. What do we mean by impaired with or without? With or without meaning that a child might have problem with intellectual reasoning. He has problem, intellectual deficiency, or intellectual deficiency, which means if a child is autistic and has intellectual impairment, it will be very difficult to educate such a child. But there are some group of autistic children that do not have intellectual impairment, meaning they can still go to school and be educated. I'll get back to that part and explain to you. So it's not all autistic children that are, in fact, there are some adults that are autistic and they go to their office, they are very, very intelligent. There are groups of autism that are under this. That's those without intellectual impairment, and some have intellectual impairment. Number two, we have those with or without accompanying language impairment. Language impairment is language disorder. The child will not be able to speak properly. A child of 1, 2 that is supposed to be calling daddy, dada, mama will not talk. He will not be able to even, will just still be he or she. But we cannot say because a child of 2, 3 is not talking, so it means he is autistic. There are other symptoms you need to look out for. So there are some children with autism that has language impairment, meaning they have language disorder. And there are some children with autism, they do not have language impairment. So they can talk, they can construct good conversation, talk to people, they understand each other and everything. That's number 2. Number 2. Yes, you are right, my brother Ike Okafo. 80% of autism is caused genetic. It's being inherited. Like I said, the first video that I made, is not all problems you found in children. You say the world is doing your child, or one witch or one village, someone is bewitching your children. Sometimes these problems are genetic. So sometimes you need to take the child to the hospital. They should do adequate, diagnosis. They should check, and they should even check you, because once they check you, they might find that it's inherited. For example, a mother that is not smoking, is not exposed to any toxic whatever, and all of a sudden the child has autism. But if that case can be traced down to the family tree and everything, we'll find out that that child actually got it. He or she inherited it from the parents. You understand? So you are right. So 80% is inherited, then 20% is caused by environmental factors. But there's a clause, we'll get there. Now they have discovered that the level of autism has increased. Why? It has really increased, meaning environmental factor is contributing seriously these days to autistic disorder. We'll get there. So number 3, we have associated with known medical or genetic condition or environmental condition. So there are some children that has autism that their problem is associated with another medical problem. And some have, like you said, my brother Ike, some it is genetic, meaning they inherited it from their they inherited it from their parents or from their lineage, or some also is because of environmental factor. Yes, my sister Paulina, if it's not genetic, it can be due to environmental factor. Environmental factor also causes it, and some might be mental factor. We'll still get there. There are so many factors that cause it, apart from genetic. A lot of factors cause it. I'm still going to mention about 9 of them. So the fourth subsection of autism is associated with another neurodevelopmental one, mental or behavioral disorder. So you see, this subtype of autism is associated with neurological development. The brain development, maybe the brain was not properly developed or something. You know, Sister Paulina, we will get there. Don't worry, we'll get there. Then also we have some autism that is associated with mental problem. Also we have some autism that is associated with behavioral disorder. Then the fifth one is associated with catatonia. I will explain and I will define the word catatonia. Catatonia is a psychomotor disorder. This is a kind of disorder that has to do with the mental function and the movement. This kind of autism is associated with his mental disorder and is linked with the movement, psychomotor. The child will not be able to move in a normal way. You see some autistic children, they cannot even move in a normal way. They have, their problem is catatonia, which has to do with psychomotor disorder that is associated and connected with the mental function of movement. So that's that. That is according to Dr. Timothy Legs, 2020. Now, a child can be diagnosed. You know, I've mentioned 5 subtypes of autism. A child can be diagnosed with 2 or more, or 1 or more of these types. So a child might have speech impairment, mental, intellectual impairment. The child might have psychomotor disorder. So a child with autism can have this subtypes about 5. Some might have like 1. Some might have like 4. Cannot speak well, cannot move well, cannot even study. If you teach the child will not understand anything, you know. So let's move to the types of autism. Number 1, when you take your child to the hospital and they diagnose the child, there are different types of diagnoses of autism that they can diagnose. The first one is autistic disorder. The second one is Asperger syndrome. It's a form of autism. Asperger syndrome. This Asperger syndrome, you can also call it AS, is a group of neurological disorder known as autism spectrum disorder. And this is a mild form of spectrum. This type of, these people, these are their symptoms. Please, everybody should listen. This Asperger syndrome is a mild form of autism, and this is their primary symptoms. Number 1, they find it very difficult in social interaction. It's not that they cannot talk, but when there is a gathering of people, they cannot socialize. Number 2, they engage in repetitive behavior. You see that person repeating one thing, keep on repeating and repeating and repeating a particular behavior. Number 3, standing firm on what they think. You know, I'm sorry, some people, when you are talking, maybe discussing something, they don't have the capability to, you know, listen to other people's opinion. But whatever they think they feel is right, they stand firm on it and they will never change their mind. I'm not saying everybody that is like that is autistic. I've listed different symptoms you can find in someone suffering from Asperger syndrome. So the last one is focusing on rules and routine. This kind of people suffering from this syndrome, they focus on rules and routine. If rules, the same rule they'll keep on following. Routine, maybe he's always, there's a way he does things. He doesn't change his routine. He follows it to the last. he can never change it. And if those kind of people are very law abiding, they follow the law to the letter, you know. So that's that with that. Individual diagnosed as Asperger syndrome. You know, I told you there's a kind of autism that they can go to school, go to work. They are very intelligent. They are normally intelligent or above normal intelligence. You know, they have very high IQ. And such people are very good. They can go to school and they have good jobs. You know, very good jobs. That's why they said, I remember when I was in the university, they said, guru. You know those guru, eh? I'm not saying all gurus are autistic or abego. Those gurus, they do routine. They don't socialize. If when you tell them something, they don't accept any other person's opinion except their own. They stand firm. I believe most of you in school, you remember such people. Those people that are so very intelligent, and such people are very, very, very intelligent. Their IQ is very high. But you see them doing the same routine. But they are very, very, very intelligent. That is a kind of autism, and it's called Asperger syndrome. And their IQ is higher than normal most times. Thank you, Dele. Thank you so much. So let's move on to the next. Now, some of you will say, can it be cured? Asperger syndrome cannot be cured. But if it's diagnosed earlier, it can be managed, and the child go through, you know, some therapy. They can help the child to make social connections, because the major thing you know about these people, they don't socialize. They are just on their own, but they are very smart, very intelligent. They like rules. They like doing routines. If they tell you their opinion about something, they will never change their mind. Even whatever they believe, if it's wrong, it is wrong, but they will never accept that what they believe that is right is right. So such people can be managed if discovered earlier. So the next type of autism is pervasive development disorder. Pervasive development disorder is not otherwise specific, meaning it is not specific. Diagnosis of this PEDNOS, you can call it PEDNOS, was given to a person that has some symptom of autism but does not fulfill the full diagnostic character. Meaning, let me break it down. Someone with autism maybe has just 2 symptoms. He has, but he doesn't show all the full character of autistic person, because a full autistic person have different symptoms. Maybe out of all the symptoms, you just have 2 or 3. These are the kind of people, you know. Meaning it's not fully, you cannot say it's full blown. Do not meet the full diagnostic characteristics of a condition known as autistic disorder or Asperger syndrome. Then the last one is childhood disintegrative disorder. This is another form of autism. Childhood disintegrative disorder. This form of autism, the child, you know, children have milestones. A child of 8 months, at least a child of 6 months should be sitting, should be able to, when you carry the baby, should be able to sit. The head should be able to stand. The head will not be doing. A 6-month child, years-old child, the head should be able to stand, you know. Do you know there are some milestones, and when the child is 1 plus, should be able to, you know, crawl, you know, hold chair, you know, that kind of thing, you know. But such children, you notice that they don't, but it's not all children, because you have to look out for other symptoms for you to be able to classify a child that has autism. So basically, let's look at the general symptoms of autism. What are the general symptoms of autism? Now, like I said, for you to notice autism in a child is usually known in early childhood, when your child is from 12 months, that's 1 year to 2 years. Please, parents, listen. A child that has autism, you will notice it when the child is 1 year to 2 years. That is when you notice that this child is not, at least he's supposed to be quarreling by now. What is happening? Why is this child still delaying? He should be able to say ba ba ba. You know, that sound that the child is showing you that he's trying to call the father, because most children call their father first. That child is not even making effort. 2 years old, he's not even, you know, that is when you start suspecting that this child might have a problem. You know, early symptoms might include a delay in language and social development. Your baby of 6 months, when you carry a child, a small child, and smile, you see the child smiling back. You know, it's a kind of social interaction. You know, all these things you have to watch out for them. The child, first symptom is the child's language development is delayed. Is really delayed, and social development. And also, they have problem in communication. The child has serious problem with communication. Cannot communicate well. Social interaction, no. And also, the child have this repeated behavior. I remember when I was in Subanjaya teaching, there's a child I was teaching, and his own is severe autism. He might be cool for a while. All of a sudden, he will just start saying, and he will be repeating it and repeating it. He will keep on repeating it. And if you don't manage that situation well, and you scream at that child, he will start screaming, scattering everywhere. Autistic children can be very, very aggressive. If you are not careful, they can harm you. They can be very, very aggressive if you don't know how to manage them. So let's move to the next. So another, problem with communication and social interaction. Difficulties in sharing emotions, sharing interests, maintaining back and forth conversation. You've noticed that the child cannot maintain a healthy conversation, cannot even maintain back and forth. You say, how are you? I am fine. How do you do? That person has a problem with that. And has non-speaking communication. Non-speaking. Like, they make some sounds. They want to communicate because they cannot really speak well. So they have to make sounds to try to make you understand what they are saying. Eye contact or reading body language. They cannot maintain eye contact with someone, and the body, like you see, they cannot read people's body language. Even if you say carry this, in Africa, you don't have to open your mouth to tell your child that you should get up. My mother will roll her eyes. Once she roll her eyes, you know what she's saying. You quickly understand that she said you should get out for there or bring water or do something. These children cannot even understand anything. So, and also, they have restricted or repetitive behavior. I'm just trying to explain the points I made. Thank you, Dr. Idris. Thank you so much. This includes repeated movement or motion or speech pattern. So this repeated behavior that I said is in 3 ways. Number one, movement. Can be repeating one movement like this. That one self in my class say, oh my God, it's really frustrating. I kudos to parents that have autistic children. Honestly, it's not easy. I had to run away from that school. I was having migraine. I won't come and die. It's not easy. That child will say, hitting the table and be saying, and you keep on repeating that movement and that sound, hitting the table, screaming. And also, speech pattern, you won't understand. Some will say, I want to go, I want to go, I want to go. That I want to go, he might repeat it almost 20 times and will be screaming, bah, bah, I want to go, I want to go. That is it. Those are the signs. Or So many things like that. Another one, rigid adherence to specific routine or behavior. The normal behavior that a child is supposed to show, they won't. Maybe the child can just be on himself. In fact, there is one, he's already getting to a teenager. It's not easy. This child will come to class and pull his trouser. Just pull, just so many tantrums. Also, an increase or decrease in sensitivity to specific sensory information from their surroundings. Just a simple sound can trigger a autistic child. Maybe just one sound, you just see, you start screaming. Just sound, maybe a car passed and horn, boom, the child can start, bah, 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 get me out, take me out, and will be screaming, home, home. So many things like that. Fixated interest or preoccupation. They have this, if they fix their mind to something, they want it. And if, for example, that video that I shared, the child wanted to go out, and she believes that she just has to go out. Every day she goes out. So once they fix their mind to something, say, I want to go out, I want to go out, I want to go out, they want to do it. So that's that. Autistic people are evaluated within each category based on intensity, maybe the intensity of their symptoms, how severe their symptoms is. And some autistics might show all the symptoms. Some might show just one or two, or very less symptoms. Then that's when you say that child has mild. Or when a child shows all the symptoms, they mean say that child has severe autism. So what are the causes? My sister Paulina thought, let's talk about the causes of autism. Yes, we said it is hereditary. Some years back, 80% of autistic children can be related to, inherited from their parents, maybe from their gene and stuff like that. But now, there are so many factors that can cause autism in a child. Number one, having a immediate family member who is autistic. Meaning, maybe, those days now, during our fathers, they don't know anything called autism. Nothing like autism. They just say they have one son that is just behaving like a mad person. They won't know that it's autism, So if there's such a case in his lineage, that autism might appear in the maybe second generation or fourth generation, meaning the gene is passed down. That's number one. Number two, gene mutation. What causes gene mutation? Exposure to, what do they call itself? All these X-ray lights. Yeah, I know be doctor. Gene mutation, when the gene mutates, meaning the gene changes. Sometimes when you are exposed to some chemicals or something can cause gene mutation, or ray of light can cause gene mutation. So this can also cause autism. Then Fragile X syndrome and other genetic disorder. So genetic disorder also can cause autism, not just inherited. Your great-grandparents might not have autism. There might not be autism in your family line, but maybe there's a gene disorder in that child, and you find out that the child has autism. So it's not only inherited. Also, being born to older parents, sisters, please give birth on time, Biko. It's not there. I've seen old women that give birth and their children are perfectly okay medically. Sometimes it's not. But yes, old age giving birth to kids can cause autism, and that is why they advise women, especially ladies, if you know you want to give birth. Don't wait till when you are pregnant before you start using folic acid. Listen to me, folic acid and vitamin B12. Vitamin B12 it helps to maintain the genetic, it prevents genetic mutation. We will talk about that some other time. But as a woman, you know that you want to give birth. In fact, it is advised that a lady, once she's 20, she should start taking folic acid. Don't wait till when you are pregnant before you start taking folic acid. Folic acid and vitamin B12 help you to maintain your hormones and maintain your gene, your whatever. We'll talk about that next time. But I advise ladies, especially if you are already heading to 40 and you want to give birth. He said, that one is good. That one is good, though some have been married for years. Yes, you know, it's God that gives children. Like I said, some people still give birth at the age of 50 and their children are okay. That is why I'm advising, once you are 40 and you know you've not given birth and you want to have a child, be taking vitamin B12 and folic acid. It will help you, you know. Don't wait until you take it. It's even good for a woman's system, folic acid and vitamin B12. It helps you to maintain your hormonal. You know, women have, once you are aging, you start having hormonal imbalance. And that's why you see a woman increasing, getting fatter, unnecessarily big tummy. It's hormonal imbalance. It's hormonal imbalance. And this thing can cause a lot of problem when you want to have a child, you know. So that's why they said you should have a child early. But if that one is not possible, take care of yourself. Go to the hospital for checkup regularly and always take folic acid and vitamin B12. So let's move to the next one. Low birth weight. Some children, when they are giving birth to, they come out with a very, very low birth weight. It can cause autism. That's why we said, women, once your husbands, now listen, when your wife taking, make sure she eats well, fruits, provide everything she needs so the child can come out healthy. It's very important because the trauma that parents go through with an autistic child, I'm sure you guys will not be able to stand it. It's traumatic. Yes, vitamin. Yes, sister, it is folic acid and vitamin B12. Yes. Any brand in mind, I'm going to check the one I use and send to you because I use it. You know, sister, I know they're old. Who are old? I take care of myself. So let's move on. Then we have metabolic imbalance. Like I said, ladies, maintain yourself. As you are growing, your system change, hormonal imbalance setting, metabolic imbalance setting. That's why you see a lady of 35, she's already looking at 50, but looking old. Take care of yourself. Then we have another cause, exposed to heavy metal and environmental toxins, chemicals. You know, those staying near industrial areas. I better go. All those industrial areas, you guys should be careful because all those chemicals they use, if you stay near those places, wahala go dey, you know. So let's move. And a history of viral infection can cause autism. I beg, parents, husband, wives, youths, this topic is very important. Take care of yourself. If you have an infection, go to the hospital so you'll be properly treated, you know, for future, so you won't have problem. Fatal exposure to medical condition, medication. There's a medication if a child is exposed to fatal. One child is exposed to that. It's called valproic acid or thalidomide. Thalidomide is a kind of medicine. So ladies, pregnant women, please be careful. I will share some. I'm going to share some. I'll share this medication so you guys should see it and take notes. Don't use this kind of medicine if you are pregnant. If you are exposed to this kind of medicine, it can cause autism in your child. So according to the National Institute of Neurological Disorder and Stroke, both genetics and environment might determine whether a person develops autism. So it's not just genetic. Environmental factors too can determine if someone develops autism. However, please, yes, I want to clear a myth that has been going on about vaccine. Vaccine does not cause autism. Because vaccine does not cause autism. There have been researches carried out on this about vaccine. A lot of old sources and untrusted sources have said that vaccine causes autism. Is a lie. It doesn't cause autism. It doesn't. Okay. So let's move to the next. How is autism treated? How is autism? Please, if you have any question, you can ask in the comment section so I can answer as I'm going. How is it treated? Autism cannot be cured. Can just be supported and, can help the child to relieve some of those aggressive or behaviors. Can help them make it mild, but it cannot cure. So there are therapies that you can use. There are behavioral therapies. There's no time, I can't go in detail. Behavioral therapies like that help the child develop good behavior, because autistic children do things in the opposite way. An autistic child can shit on the bed, mess on the bed, mess himself up. An adult, especially an adolescent that is autistic. If a child is autistic and is an adolescent, it's just entering puberty, there's a problem. You have to control the child well, or else the child will start exhibiting some sexual traits. You see him pulling his pants. If you see a female child or want to hug, they can't control themselves. So there are some therapies you can do for the child to help to control these behaviors. Then we have play therapy. I love play. Play is good for anybody. So you can use play therapy to help control and support them. We have occupational therapy. Yes, occupational therapy is very good. Like I said, autistic children are very good with handcraft, especially those ones that have intellectual impairment. That's what I mean by intellectual impairment, is an intellectual disorder. They cannot study. You can train them with handwork. And funny thing, I said autistic children are good singers. If you watch the lady's video, is on my page. The way she's talking, I want to go, they sing well. They are very, very good singers. So you can use those therapies for them to help calm them down. We have physical therapy, especially for those that have the psychomotor disorder, that has a problem of the mental disorder that links with movement and function. You have to do physical therapy for them to help them, support them, and reduce the maybe movement disorder or stuff like that. Then we have speech therapy. You can also help them with their speech, because they make sounds, bit by bit. They'll start developing small, they'll start speaking gradually, and you have to be very, very patient. Also, massages is good for an autistic child, especially those ones that have movements problems. Some of them cannot even hold a pen, so you have to help and massage them. You massage them and help them a lot. Weighted clothing and blankets and medication techniques might also help autistic children manage symptoms. You can imagine funny things that you don't even think of. Weighty clothes, meaning clothes that have weights and blankets, can help them manage some symptoms. However, they said the result is rare, but at least it can help a bit. And like I said the last time, music therapy is also very good. Music therapy, I looked at it a little. You can get drums. You know, those children like repeating something. Get drums, get guitar, let it be beating. Bah, bah, bah. At least the child will be able to express his or herself with that noise. Let them make that noise. Hit the drum, bam, bam. If it's anything that the child can use to make music, play music. You see the child singing. They have good voice. It helps them to calm down, you know. So let's move on. Alternative remedies. There are other remedies. In fact, they are kind of food you can give to an autistic child that helps them also. So let's look at the alternative remedies that you can use to help an autistic child. Well, there's some remedies can be dangerous, but we are just going to talk about the safe ones. High dose of vitamins. High dose of vitamins. Please, you should be careful administering vitamins to your autistic child. It's better as a woman, before you even think of giving birth, start taking the vitamins so it will soak in your body. Take the vitamins, I said, folic acid and vitamin B12 is very important. You can use high dose of vitamins for an autistic child. It will help them. It will help them. You can use chelation therapy, which involves flushing metal out of the body system. And this is when the root cause of autism in that particular child is because of exposure to metal. Metal can cause it. So, chelation therapy flushes. They will flush the metal out of the child's body. Yes, this and it will be very expensive. So, and I don't know if they do it in Africa or in Nigeria. I don't know. So maybe you have to fly that child out of the country to get the. So the best thing is that don't even stay near industrial area. Those of you renting house near industrial area, I advise you, especially all those industrial area that mix metals, iron, and all those jabba things. I beg. If I would advise you, don't build your house close to an industrial area that has to do any chemical factory or anything. Don't expose yourself. Try to stay in a place that is environmental friendly. So another one is hyperbaric oxygen therapy, meaning this thing will be given to the child. Hyperbaric oxygen. I don't think these treatments are available in Nigeria. I don't know, but these are other methods they can use to help reduce the symptom of autism and all these methods will be very expensive. Then we have melatonin to address sleeping issues. I guess this melatonin has to do with sleeping pills, but please, I will advise you, don't give too much sleeping pills to them, because so you know go give over sleep pills for your child, because I know frustration can lead. In fact, there are some things I'm not going to mention here. There are some things I will not mention. And advice have been given that before you go into any alternative therapy, parents and caregivers should weigh the research and financial cost, because all those oxygen, whatever, and kinikon that you flush metal, and no be small money. You spend, you nearly sell yourself, because I don't think they have all those things here in Africa. You have to fly the child abroad, all these developed countries to do. Even here in Malaysia, I tell you, the school and not be say those children, their parents don't have money. They have money. They are autistic and they didn't go for all this alternative. I don't know, maybe they are exposed to it. I don't know, but when I was there's nothing. I didn't hear anything about all these methods, but these methods are available. They can use it to flush whatever thing out of the child, and the child will be much more better. But it's very, 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 yes, NNPC, please. The riverine area, you people that are very close to all those chemicals, it is well. All I will say is it is well. And you know, Nigerian system, we have oil spillage and everything, and people drink. Oh my God, yeah, Allah, God should help us in Nigeria. I don't want to go into politics. Let's talk about autism. Be careful. Don't expose yourself to chemicals, please. So let's move on. Let's talk about diet. What kind of food can you give an autistic child that will help reduce the symptoms? There are different kind of food, no specific kind of diet, but there are some types that will help minimize the behavior issues, to help reduce the behavior issues. So let's look at this type. A foundation of autistic diet is avoidance, no artificial additive, no sweetener. Nigerian children, you like sweet, everything sweet, sugar. Your child is crying, yeah, you give am lollipop, yeah, you give am this thing. Don't give them sweet things, preservative, anything that has preservative, anything that added color, they add sweetener. If you want to add plus your problem, give them. If you want to add to your sorrows, you want to add more sorrows inside your sorrow, give them food that has sweeteners, give them food that they put color. You people that used to cook rice, why would you just cook your rice, normal rice? Cook rice, normal. Cook your jollof rice with tomato, pepper, and all this thing. You go and buy color. You start putting color. And it's for patio, and you don't know how many children, people that will eat it. Please, let's try to minimize the way we eat chemical. Stop adding colors inside your food. It's not by force to take sweet things. Stop adding all this preservative, all this yama yama. These are chemicals. Yes, sugar makes people more active. So you put sugar, you give them 100% energy. I pray you will not even, because autism, you can sit down in your parlor, that TV that you think you spend money, you will just break it and break it on the ground. You will just carry the TV and go bam, and you cannot beat the child. You cannot. Let's move on. So, types of food that are good for autistic children are: number one, fresh fruits and vegetables. Fresh fruits and vegetable, make it available. You can have pots, big pots, and do some vegetable, okra, tomato, all these things. Behind your house, plant guava, pawpaw. You know, these things are expensive in Nigeria now. So you have a small garden and have these things there. Lean poultry. Not agric poultry, not chicken, agric chicken where they don't put injection, put all the chemical, feed them. Chicken that is supposed to take how many months to grow, it will grow within 1 month. Not that type. Local chicken. Give them local chicken to eat. Don't give them all this chicken that they've put chemical to do. Fish. Fresh fish will not be chemical fish. Fish. Unsaturated fat. These are healthy fats. Lots of water. Make water available to them. And some autism advocates also endorse gluten-free diets. That's some. So anything that is not agreed by all, I won't take it. Just take the ones that is agreed by all. Good. Then the protein gluten can be found wheat, bread, barley, and other grains. Wheat is good, barley, or other grains. You can get that from. So some other researchers believe that gluten creates inflammation and diverse body reaction in certain autistic people. Yes, some, not even only autistic people, normal people that are healthy. Some grains it creates side effects, reaction, allergy. Like me, I cannot take soya beans, and I'm not autistic, and it's grain. I can't take soya beans. If I take soya beans, I'll start itching. My body will start itching. So it's not like they said. They said some. So you should watch your child and know what is good for that child. And also some studies said, and studies also suggest that diet can help improve symptoms of attention deficiency hyperactivity disorder. This is another topic for another day. You know, so many, I believe some of you say all these big word I'm calling. This is another disorder, hyperactivity. They call it attention deficit hyperactivity disorder. This is another topic for another day. But we Africans, we are always hyperactive. We are very active, but there are some levels of hyperactivity that I saw that I thought that child was mad. He's not mad, but he has this attention deficit hyperactivity disorder. That child is not autistic, but he just has it. But when that thing starts, if that child doesn't take that tiny pill, once he goes to school, his name is Ayon, he's a Chinese boy, I'll quickly give him his tablet. If he doesn't take it, yay, wahala go. When that thing starts, he will start acting like a mad boy, jumping from one table to the other, screaming. So that's another topic for another day. I don't think we really have that in Africa. Whatever, we'll talk about it next time. Then, it's also similar to autism, but not like autism, but it's another level of being active. So I'm going to stop here today. I believe with the little discussion we have had today, we've talked about the different subtypes of autism, types of autism, causes of autism, therapies that we can use to reduce the behavioral disorder, and also the kind of food we can give. So next time we will discuss about the effect of autism in a child, in an adult, and we'll be done with autism. So we might take up another topic. The other topic I will take up after next week Sunday will be dyslexia. I know some of you might not have heard that word dyslexia, but it's a common thing in Africa. Dyslexia is a reading disorder. A child of 10 cannot read, and you keep on beating that child. Bass. My child is not reading, it's not reading, it's not reading. There's a disorder that causes that. Yes, it's not that the child doesn't want to read, but there's something causing the child not to be able to read, and that deficiency is called dyslexia. That's reading disorder. But I'm not going to talk about it next week. That will be upper week. Next week we'll still continue with autism. We'll talk about the effects and other things, how it affects adults and stuff like that. Then upper week we'll talk about reading disorder, dyslexia, because a lot of children in schools, in fact, some children, they beat them, call them olodo, so many things. I think I'm going to stop here, and I don't know if anybody has any question. If you don't have any question, I'm going to call it a day. Thank you for attending. Please, I need you to share with other people that want to learn from this, and hope to see you next week Sunday, same time, 4 p.m. Thank you so